The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome to today's installment of our podcast, TMD Demystified. I'm Tony Urbanek, and we are going to carry forward our concept this morning in a very direct way. I'm going to give you something this morning that is probably going to be, at least toward the end of it, controversial, may bring some remarks, which is fine. But I'm going to give you this morning what in the dental industry would generally be called a pearl, but I would prefer to call it this morning a diamond. I'm going to give you a diamond, and if I can present this correctly, and I'm going to try to do this, it will help some of you who follow me through and follow along. It may actually make a profound difference in how you operate as a dentist, or as a person, or in many other areas of your life, anything that you want to get accomplished. Because today we are going to talk about competence. Now, I'm going to limit it to, I'm not going to talk in a general nature about competence. I'm going to talk specifically, but we're going to limit it to competence when it comes to or addresses the issue of TMD. So I can probably talk about generally also, and the general concepts will apply to, in our case, TMD. So I try not to get too far distant from the topic at hand. But competence in any endeavor, obviously, is really important. I don't think I need to discuss that a whole lot further. If you are a very competent person, then one way or another, you will be successful. Successful in economically, you'll be successful with the knowledge that you are competent. You will be held out in the population or in your field in a very special way, because actually in our environment, competence is not very common. Actually, how common it is, I'm not going to try to dissect that or tell you, but I would say that most of you would agree that true competence is not the usual and customary in our environment and our population. I wish it was otherwise, but it is a true statement. Okay. So competence, here's the formula. And then we're going to dissect this and discuss it so that hopefully I can get understanding from your point of view, that you understand. So the formula is very simple. Comprehension plus effectiveness is competence. Comprehension plus effectiveness is the definition of competence. If you can be comprehensive, and there's several definitions for comprehensive, and the definition that I'm using here is the more archaic definition: to comprehend, to be comprehended, to comprehend, to be comprehended, to be comprehensible. In other words, your communication creates a situation where the other person can comprehend what it is you're saying. And if you do that, and what you're saying is effective, In other words, it creates an effect that you say it will, then you yourself will be competent. You will be looked on as being competent by others. You will be competent in your profession. You will be competent in that action that you are trying to get accomplished. If you can understand that and apply it to anything in your life, that's a concept that is not a pearl, it's a diamond. If you teach it to your children, it's a diamond, because it can be used in a million different ways. But today we're just going to talk about how that applies to TMD. Because in previous installments of the podcast, I discussed at length why it is important to be competent in the field of TMD in front of and with your patients and with your colleagues. Unfortunately, there is a lot in this specific area, in the issue of TMD, there's a lot of incompetence. And I'm not attempting to be critical of anything or anybody, any concept, although you may want to take it at that, that is not my intent. But if, and this is the case, and I'll talk specifically about this later a little bit, if a doctor gives a patient a service or a procedure or a device or instructions that does not solve the problem, by definition, that doctor is incompetent because he was not effective. If you're not effective, you're not competent. If I hire a plumber to come in my house and fix the toilet and it doesn't work, well, what do I think about that plumber? He's incompetent. So, and that, what I just described, is actually pretty much the norm of the treatment of TMD in the United States of America and worldwide today. I have a long history of treating TMD, and I will be the first to say, because I gave up intentionally trying to fix patients surgically 10 years ago. I did years and years, probably too many years, trying to help people with their symptoms of TMD using surgical services. I take responsibility for that. I did that. I admit that. And some of the people I help and some of the people I know, they come back even now, and they come back and thank me that the surgery that I did for them was effective. But what I saw and what I did 10 years ago, I saw more than I wanted to of patients who would come back in my office after a relatively short time, 6 months to a year or two, and they would continue to have symptoms, although I had already done surgery for them. So by my definition, I was incompetent at providing what I hoped to do and what I expected to do and what I told the patient would hopefully be the outcome. So this is not new in any doctor's environment. I mean, if I was a heart surgeon or a brain surgeon, if I was a neurosurgeon, or even a PI, a general practitioner of one kind or another, and you do a service, you hope it's going to be effective. And there are no guarantees in medicine. There are no guarantees in dentistry. But I hope, among hopes, that everybody that's listening to me wants to do the best they can and wants to do a good service for their patients. So back to the specifics of TMD. So what are these two components that complete the concept of competence? The first one is to be comprehensible, to be in your communication with the patient or your colleagues, to describe or talk about TMD in a way that makes sense, that they can comprehend. And so what I see frequently and what I observe through my patients' communication, what I see even in the literature, I read an article, it was in a throwaway. I won't even show it to you, won't even discuss. It was in a throwaway. It had to do with a doctor whose practice was coming off the blocks, primarily treating sleep apnea, limiting his practice, a dentist, limiting his practice to sleep apnea and TMD. And the article was fairly incomprehensible. I couldn't follow it. I couldn't follow the concepts behind it. I knew what he was trying to say. I know what he was trying to do, but the article itself was generally incomprehensible. So in my previous discussions, it is important in your discussion with patients with TMD, whatever you tell them, whatever you want to say, whatever your theory is, whatever your concept is, whatever your treatment is, it is important, if you want to be looked at as competent, that you are able to discuss it in terms or in words or in concepts or in sentences that are comprehensible to who you're talking to. So obviously, if you're talking to a patient, you need to tone it down. You need to use smaller words. You need to find words that get the point across. And if you're talking to colleagues that understand a little bit more about TMD, you can use more technical words, that's fine. But the point is, what you say has to be comprehensible and it has to make sense. So it's not just learning the language and the nomenclature or words that the patients understand, but what you describe has to make sense to the patient. And if you've watched, and I suggest you do, watch one or more of my patient consultations that are on the podcast, I designed those very specifically, and they may not be perfect. They were my attempt to be comprehensible to the patient. So the patient would comprehend, number one, they would comprehend the problem itself. What is going on inside, literally to them, what's going on inside their head, because to them, it's just one big head mash. And all these various symptoms that they certainly don't understand, and they describe them all kind of different ways, but they need to and want to comprehend why they're having all these different types of symptoms. And some of them they feel they know they're coming from the temporomandibular joint, and many of them they have no idea what those symptoms, what the cause is, what the relationship to the temporomandibular joint is, and why that's happening. But they, being the patient, they definitely deserve an explanation that they can comprehend. So that's the first point. And if you think that it's not important, then you don't think that your competence isn't very important, because you have to have comprehension to have competence. And the second is whether or not what you offer, what you do, what you talk about, what you promise, if you want to promise, is effective. And that is fairly, no pun intended, cut and dried. You can monitor whether something is effective or not. You can look at it. You may not want to look at it. You may not want to confront how ineffective what you're doing is. I finally gave up, and I was confronting the results of my surgery, and I did all along. But I finally got to the point where I said, the results are not good enough for my purposes as a doctor and a surgeon. So you have to be effective. It is very important. It has to be effective in front of the patient, and it has to be effective in front of your colleagues. And that is the second point of being competent. And if you can provide comprehension and effectiveness, then you will be absolutely considered in your own mind, in the minds of others, in your environment, in your community, within the professions, you will be considered competent. Now, how important is that? I think it's really important. I think it's most important. If you deal with the science, and you consider yourself somewhat of a scientist and monitor science. And, the scientific method can and will be used to determine what you do, whether or not what you do is effective. So regarding what I've learned and discovered regarding temporomandibular joint problems, number one, in treating patients, because that's what it's all about. It's not about writing papers. It's not about doing studies just to do studies. You do studies so that you can apply it. So the first part of being comprehensible to the patient, whether you use a method that I use or you figure out your own way to describe the patient's problem to them, why they have these different symptoms, and how it all is related to inflammation within the temporomandibular joint. And that is described extensively in other parts of the podcast and in the other items that I have produced, in the course itself, to using the Urbanek device and protocol. And then finally, is it effective? And in that regard, regarding TMD, I already mentioned in a prior podcast that our study is out based on 3,000 cases that I've done in my practice, an independent study that was done through Middle Tennessee State University that showed that the success rate subjectively noted by our patients is 85%. And I would just add that my issue with that number is that it doesn't include the concept of patient compliance, because I know I see it every day. A certain percentage of the patients will just not comply with the protocol, which is very simple. And that may or may not explain the other 15%, and it doesn't make any difference. But if you have a procedure, if you have a service, if you have a device and protocol that provides 85% satisfaction with the patients in their subjective point of view, from their subjective point of view on the issue of TMD, then that device and protocol should be considered effective. And now it's in a study. The white paper is available, and the actual academic studies, of which there are academic papers, of which there will be 2 separate academic papers that will be based on that white paper, are coming out and will be peer reviewed and published within the next 6 months to 8 months to a year. So that's a diamond. I hope I got the point across. I hope I didn't belabor it too much. But it is true. And I'm willing to discuss it, and I'd love comments about it. But what I'm asking is that you try it out. You just try it out. Think about it. Think about how to apply that to TMD. And if you're treating TMD, or you'd like to treat TMD, or you don't want to treat TMD because you don't feel you can be comprehensive about the problem, that the other person can comprehend what you're saying, or that you can't be effective, well, then you don't want to treat TMD, because now you're not competent. And we want people that are competent, that actually can look at a patient in their eyes and say, I'm going to make these symptoms go away. Your job is to do the protocol and wear the device according to the protocol. So to kind of finish this up, I want to talk about a couple things that are going on in our profession that I just have to bring out. And again, my issue is not to criticize, but I see it so often. We just have to fix this. Like I had to fix my dependence on surgery to try to fix this problem. We have to change the concepts out there that are going on in dentistry, kind of SOPs, standard operating procedures. In aviation, we operate with SOPs. If you fly an airplane, you have checklists. You do a pre-flight checklist, you got a pre-takeoff checklist, you got a landing checklist, you got emergency checklists, and those are standard operating procedures. And there are standard operating procedures in dentistry by dentists that are extremely common that don't work. That would be terrible if you had a SOP, a pre-flight checklist, and you use that constantly, but the airplane would crash after takeoff. This would not be acceptable. So there's a couple points that I want to make that appear to be SOP in dentistry about TMD that I need to bring out. The first one, both of them are centered around the concept of night guards, because I see frequently patients will come in to see me with 10, 20, 30 years of symptoms, and I know what to expect when they walk in the door and they have a little bag, usually a paper bag, small paper bag, and they shake the paper bag, and I know what's in them. It's like 3 to 10 night guards. And I don't even ask them, so I don't want to look at them. I already know what's in them. But here's the point. It is just inappropriate to make a night guard, and I'm not against night guards. Night guards are fine. If you tell the patient that night guard is going to protect their teeth from damage if they wear it, that's awesome, because that's all it does. Whether it be an upper or lower, soft or hard, all that night guard does is protects the teeth so that when they brux, they don't grind on the teeth. They grind on the plastic, on the acrylic, and they will not damage the teeth themselves. But what I see and what I'm told by hundreds and hundreds of patients is that they have been given a night guard and told them that this is treatment for their TMD. Now that's an SOP that's inappropriate and bound to crash. Bound to crash, predictable to crash. So I ask my colleagues listening to consider that if you make night guards, don't tell them that it treats their TMD. Be truthful, tell them it protects their teeth, and that's all it does. And the second point is related to that, and that is, I hear from patients, hundreds of them, that they were told by their dentist that this night guard would somehow magically keep them from grinding their teeth, keep them from bruxing. Now, on that point, same thing. I mean, a night guard or any oral device does not keep anybody from bruxing. We do not understand the mechanism for bruxing. The only thing we know about bruxing, the only thing we actually know about bruxing is that it is related to stress. There may be other things related, there are other things related to bruxism, but the only thing we are certain of is that stress increases bruxism. Now, the mechanism how that happens is we don't understand, but I can tell you what's going on generally, in that anxiety somehow stimulates the central nervous system, the brainstem, and somehow that creates a mechanism to brux the teeth. But what's the somehow? We don't understand that. There are theories. I like theories. We can read theories. neurologically, anatomically. I'm an anatomist by training. I understand the nervous system. I'm an anatomist and cell biologist by training, besides a dental and a medical degree. But I will be the first to say we do not understand the mechanism of how increased anxiety will actually cause, through the central nervous system, the bruxing mechanism of the jaws and the muscles. But we know it does. Other than that, we don't know. We don't know. And for you, the dentist, to tell patients that this little night guard is going to keep them from grinding their teeth is not the truth. It's not truthful. If any of you have a study out there, a valid study, that shows that a night guard will stop somebody from bruxing their teeth, I'd like to see it. I truly would. And I'll eat my words. So those two items, I want to get cleaned up in our profession. Number one, that a night guard treats TMD, which it doesn't. And in fact, frequently it makes it worse. I mean, just as many people who come in and say, I've been told that this night guard is the treatment for my TMD, just as many of those people come in and say, you know, I put this in my mouth that actually made it worse. Well, I know why it made it worse. But I won't go into that right now, but I hear it all the time. Yes, many patients put it in and it makes it worse. And then the concept of telling patients that somehow magically this night guard, maxillary or mandibular, hard or soft, is going to keep them from bruxing is not true. I tell patients constantly, there is no solution for bruxing. You're never going to stop. Half the population bruxes, which is about correct. Most of them are not aware they do it. Most of them may not get into symptoms, or may, but it's extremely common. If you want to call it a habit, I'm not even sure we can call it a habit. It's a reaction. It's a reaction that has something to do with anxiety. It may have reactions to other things that we're not aware of right now, but don't tell them that a night guard is going to fix their bruxism, because that's not true. So for those of you who are interested in learning more about TMD, those of you who want to treat TMD successfully, I welcome you to follow us along on the podcast. For those who really get interested, I encourage you to look into taking my course and using the Urbanek device and protocol effectively in your practice. We have the stats to prove it. We now have a verified study, independent study, to prove it. And I would like to hear from you. I would love to hear your comments. I would even love to hear your criticisms, because I'm not an argumentative person, but I do confront facts and truth versus things that are not factual. And my purpose in this podcast, as the title describes, is to demystify TMD. And this podcast, which is the number 19 that I've produced, is my simple attempt to demystify a couple of the mystical parts of TMD that I have witnessed all my career, not just in the past 10 years, not just recently with our study, for 40 years. I mean, I was mystified too. I was mystified how no one could figure this out. We did all these ineffective things. So to summarize, I would love all of you to be competent, to consider using competence in everything you do in your life. And to do that, it is important to be comprehensive in your discussions, in your descriptions, in your language, and to be effective in what you do. So I am Tony Urbanek. I appreciate your watching this edition of TMD Demystified. I invite you to become a doctor who wishes to practice and actually solve the TMD problem. So until next time, enjoy your week, and I look forward to speaking with you again.